I'm Hunter Carrison with HHK Healthcare Marketing Specialist. Today we're talking a little bit more about thriving in the new normal with our Healthcare Leadership Symposium. We're here with one of my favorite people, Deb Mauk of Coastal Pediatric Associates, Coastal Pediatric Research, and Charleston Breastfeeding Center. Hi, Deb.
Hey there.
Welcome.
Thank you so much for having me.
I'm glad you're here. Let's talk a little bit about first what Coastal Pediatric Associates is.
Great. Well, you mentioned some of the different arms we have at Coastal, and I'm excited to be able to share a little bit more about it here today. Coastal Pediatrics has 8 locations throughout the Low Country here in the Charleston. We have 4 locations for primary care with our pediatrics, and we have 2 breastfeeding centers of Charleston. One is in our Somerville market, and one is in our Mount Pleasant market. We also are really thrilled to have a research arm that is quite large. We have over 12 associates within our research, and we really are excited to be able to be there for the cutting edge for the future of pediatric practices.
Does that make y'all one of the larger practices in the area?
Yes, it does. We are thankful to be able to service multiple areas within the Charleston Low Country area. We have offices in Mount Pleasant, James Island, Somerville, West Ashley, so we're able to be in your neighborhood taking care of your kids close to home.
So that mission, just thinking about it a little bit, of taking care of children in your community that you serve, how did that mission factor in when COVID-19 hit?
Boy, that was difficult because it really rocked the Low Country as it did the entire world. We needed to take a look at what was happening to our patients, what was happening with our parents, and do the right thing to be sure that we were being safe. We were providing care because children were still getting sick, because children still needed to get their well visits. We really don't want, in the middle of a pandemic, to stop the vaccines. That's an important part to make sure that we're continuing with that.
Can you talk to me a little bit about some of the strategies that you put in play during COVID?
Sure. And I have to first say it is because of my partners, it is because of our senior leadership and the entire Coastal Pediatric team. First and foremost, what we wanted to do is ensure our team members were safe. Many team members did not have daycare during that time. Many team members were worried about taking care of their family members. There was also a fear of when you're in a pediatric practice, coming to work day in and day out and having an elderly person in your family. So we had to first take a gut check and see what our team needed. That was first and foremost. Second, what we did is to take a look at what resources did we need to bring to the table. And one of the coolest resources that we did is we called it Coastal Curbside Care. So you may have been out there with us. We started in the West Ashley office, and it was a drive-through care. So while our intent was to make sure we had a well location and we were keeping sick patients outside of the 4 walls of our clinics. Now it got a little hot sometimes, got a little rainy. I think a tornado kind of came through during some of the times when our offices were open, but our team was fabulous working out there, working with the patients. It was amazing. So our intent was to do what we could, keeping patients out of the clinic, out of the drive-through, and that really, our volume we had probably had 25% of our patients were going through our telehealth at that time.
What were some of the unique things that you think your practice did to rise above the pandemic?
We really took a look at what our patients were asking for. Mm-hmm. They really wanted to make sure that the well visits were in a well space and the sick patients were not being seen during that time. So during a normal practice, you put your well visits in with your sick and then you go about your day. We really had to take a look at how do we make this change? How do we make sure we're having a clean environment and separating the patients? But we also look at anybody walking in our doors who has the potential of having COVID. So PPE is personal protection equipment is the top issue for us. With the sick patients, we really have in a COVID potential exposure, we really are increasing to the CDC guidelines and following every precaution that's necessary. We did shut down our waiting rooms. That's some good and bad with that. You get your children able to run around and watch a movie, but now you have to sit in the car, and that's okay, and patients have adjusted tremendously well with that, except for once in a while it's hot. You might not have air conditioning, so we're looking at it on a case-by-case basis.
Talk to me a little bit about how that impacts your newborns.
Our newborns we really make sure we've got the opportunity to put them in a very safe environment. We know our moms coming out of the hospitals, and we know where those newborns are at. We have primarily used our breastfeeding centers as our newborn locations, and it has been an awesome transition. Mm-hmm. Even though they are called the breastfeeding centers of Charleston, they really are catering to that new mom and that new baby in that environment where it is highly, there are no sick patients coming in.
That's really great. Are there other places that you feel like you've kept your well visits going? Other ways that you've kept them going? Because we keep hearing about how important keeping that well visit is.
Definitely. A big portion of it is to push out to the parents, giving them calls, mm-hmm. sending them reminders, reminding them that they missed a well check, reminding them that we are safe. We do have a wonderful marketing firm that we work with that does email blasts to our patients to keep them informed of what's going on, what's the latest in the community, what's the latest with COVID. Is there things that they need to be prepared for? So we are very lucky to be able to have multiple ways to reach our parents.
What would you say the parents' primary concerns or / questions have been?
For the parents, it really is the safety of the kids as they come into the clinic. You don't know what's in the clinics, but then when you look at the care of the patients, it really is, kids are resilient. Kids are, the younger ones are striding through this. It's different, they know it, but mom and dad are very concerned for their kids. And that's where we're spending some time on the practice side, is working with moms and dads, helping them work through the issues they have at home, working through the issues with the children. How do we establish and help them establish a schedule for the older children so they can get back into that routine of school, and how to set some guidelines, because it's been very difficult to co-parent or to parent while the kids are at school or at home. Sorry, I just meant it. It's very difficult to work from home and homeschool your children, and we're trying to help in all different areas.
What would your advice be to the healthcare leader out there listening to us today for thriving in this new normal?
Our employees left their home base and went to any of our other locations, picked up, changed their hours of operations, and just basically did what it took to make sure we were able to keep open and be there to take care of our patients. I'm really proud of our employees. They really were flexible. They really stepped up. And as a leader, helping them come up with the creative ideas, or let me rephrase that, as a leader, watching them bring the ideas and helping them implement those was a very successful part of why CPA is doing so well right now.
So your healthcare heroes, so to speak, how do you think they're feeling today? Have things changed?
We did do something pretty interesting that I think was on the cutting edge, and we did start COVID testing for our patients. So we did bring in our own, a new model, Sophia 2, that came in. So we are doing testing. Our patients.
This is like new news.
This is good. I need to get it out. It is a 15-minute rapid response. Now we do say it's in 24 hours, but we usually are able to provide the patient with the answer by the end of the day. Just kind of depends on what's going on. But it really is giving that feedback that helps the parents make the decisions, helps the parents decide if they're going to go to see grandma, if they're going to stay home in quarantine, and for them and their own jobs. It really is an impact to the entire family when somebody in the family has COVID.
So for Sophia 2, do you have anything else you can share with us about that? The rapid test?
Yes, thank you. Now, being one of the first pediatric practices in the area to be able to provide COVID testing with results from our own lab, we were excited to be able to bring this. So a rapid result, we will get it to you within 24 hours. And Sophia 2 says it can do it in 15 minutes, but we don't want to set any expectations that we may not be able to deliver based upon all the volumes that we have in our clinics. We also are looking at expanding to making sure from that family unit we're able to test parents that want to come into our clinics. If you're here with your child and your child has an exposure, more than likely mom and dad have an exposure. We want to make sure that family unit is ready to go during this COVID, this pandemic crisis.
So economic stability for the community as well as health and wellness for the community. So again, here you are really having a community service focus. How did the crisis change that for you all? I know you've always been a big member of the community, but how did it really bring that into play?
We had to take a look at it a little bit different. So when we started with a couple years ago, the partners implemented the opportunity to give 4 hours per employee to go out and volunteer. We provided different activities, different events within the not-for-profit locations, and gave our employees the opportunity to take a half a day off, go work within the community, learn what community giving is. Many of them already do this on their own, but we wanted to have them go ahead and spend some time giving back. And also, then there was a little slight nudging request, see if you could do 4 hours on your own so that we can build our employees and build a community and give back to this awesome place that we're able to serve.
What have you done to try to make sure that that patient volume is at least maintained?
We are using we really have gone back to the old forms of communication and expanded on our portal, our patient portal, to really open that up for more the generation that doesn't like to get on the phone but would like to be able to put a question in on the portal and then we can answer and respond back quickly. We're using that to provide their lab results so they don't have to wait for a phone call. We're using that to remind them of, do they have a patient appointment that they missed, or that it's really important for a med recheck, or that you come in for your well check. We also are looking at our hours. Our hours have changed because the demand has changed. So we used to be open from 7 a.m. till 8 p.m., but during the pandemic, with people not working, out of the home, as well as children not playing, our sick visits are down significantly. We expect that usually we see the peak go in September till February, March. I think it's going to be a little delayed with school, but we will take a look at what's happening and we will pivot and we'll make the changes. And I think what's awesome about CPA, Coastal Pediatric Associates, and our employees is they have been very flexible. Again, knowing that what is special about Coastal is that we are open the extended hours so patients can come to see us before work or after work, and we're open on weekends. And that takes a lot for our employees if they want to be able to, it takes a lot for our employees to be able to cover evenings and weekends as well. But we also feel that's part of our service back to the community.
Any other critical strategies you'd like to share before we close today?
Well, telehealth, we mentioned that briefly before, but telehealth is changing the way that we are practicing. And from a healthcare leader standpoint, right now we're being able to be compensated at the levels of a normal patient visit and clinic visit. We really need to work with our insurance companies to make sure that they are going to continue to be able to reimburse at that same level. There's talk that they are going to go pre-COVID levels, which does make a significant impact. But the reason we feel it's valid is that this is a new way of doing business. Patients like this. They can sit at home. They don't have to get in the car. They don't have to drive. If it's raining out, they don't have to worry about the traffic or all of the bridges. And they're able to see their provider at the comfort of their home, be able to be assessed, get their medicine ordered, and not even have to leave. So we're really hoping and working with government to make sure that we will continue to get reimbursement to be able to provide that level of care that now is the new norm. I think it'll go back that people do want to be seen face-to-face for sick visits. We aren't doing well visits right now in telehealth. We do feel it's important to have the patients come into the clinics. But again, COVID, cleanliness, all the rules and regs that are out there, CDC's asking, we're making sure that we're following all those.
What should that healthcare leader listening today do to make a difference as far as our insurance companies continuing to reimburse? I think
what the number one, work with AAP, American Academy of Pediatrics, for us in our space. Work with respond to each one of the insurance carriers and let them know the volumes that you've had, the increase, the patient satisfaction, and the outcomes. And those are really what we use when we are negotiating, which I think any practice is doing. But we really want to focus on what that impact is for our patient and the outcomes that they get, and that they're able to get that visit quicker, faster, and be able to be treated and heal quicker as well.
That was a lot of really great information you shared today, and we really appreciate you coming in.
I appreciate your time. Thanks for having me.